A dialysis order standardizes treatment, improves safety, and optimizes resource management. It facilitates clear communication among the healthcare team, streamlines billing, and serves as a legal record, enhancing overall patient care. To create a dialysis order, follow the following steps. Navigate to the dialysis module and select Dialysis Order. In the new window that appears, navigate to the top right corner of your screen and click on Actions tab. On the menu list, select Create Dialysis Order. In the next window, fill in all the required fields. Select the patient you wish to attend to from the drop-down menu. The My Room option will display all patients currently in the room you are located in, while the All option will show all patients who have been queued in different rooms. The Inpatient option displays all inpatients currently in admission. In the Type field, specifying the type of dialysis, for example, hemodialysis, allows for tailored treatment based on the patient's condition. Input the treatment number, which provides a unique identifier for tracking and referencing the treatment session, improving documentation and continuity of care. Next, select the vascular access, which identifies the access point from the drop-down arteriovenous fistula, arteriovenous graft, and vascular access catheter, ensuring proper connection and minimizing complications during treatment. Recording the patient's HIV/HBC status is crucial for taking necessary precautions to protect both the patient and healthcare staff. Make your selection from the drop-down and enter the intake, which documents the patient's fluid intake, which is critical for managing fluid balance and preventing overload during dialysis. Enter treatment time in hours, which specifies the duration of the treatment, allowing staff to plan and allocate resources effectively for patient care. The Wait Before field records the patient's wait prior to treatment, essential for determining ultrafiltration and evaluating fluid status. Similarly, the Target Wait establishes the desired wait after dialysis, guiding fluid removal to ensure patient safety during the session. Input total ultrafiltration, which indicates the total volume of fluid to be removed, ensuring precise control over fluid management. Select membrane type to specify the type of dialysis membrane used, which can affect the efficiency of treatment and patient tolerance. And enter the dialyzer, which identifies the specific dialyzer being used, ensuring compatibility with the patient's needs. Potassium bath allows for customization of potassium levels in the dialysis solution, which is crucial for managing electrolyte balance. The dialysis solution field specifies the type of dialysis solution being used, essential for effective treatment tailored to patient-specific needs. Proper priming ensures that the dialysis system is correctly prepared before treatment, minimizing complications. Record the priming based on your interventions. The screening date records the date of the patient's last screening, ensuring that the treatment plan is based on the most recent health information. Finally, the blood group and rhesus factor fields identify the patient's blood group and rhesus factor, respectively, which are critical for ensuring safety in case of emergency blood transfusions during treatment. This comprehensive approach to data collection enhances patient care and safety throughout the dialysis process. From the drop-down, select the blood group and the rhesus factor as shown, then click on the Create button to save. A dialysis checklist improves patient care by enhancing safety, reducing errors, and standardizing practices. It facilitates communication, creates a permanent record, streamlines treatment, and serves as a training tool. Additionally, it engages patients and helps identify potential issues early, leading to better care standards and experiences. It's crucial to ensure that the dialysis checklists are properly configured for your selection. To do this, simply select Dialysis Checklist as indicated. Configuring a dialysis checklist is essential for enhancing patient safety by minimizing errors and ensuring adherence to protocols. Process standardizes care, improves consistency among healthcare providers, and facilitates better communication within the team. Enter the specific name of the checklist and the description, which provides more details and explains purpose and specific components of the checklist. Check is active to confirm that it is intended for immediate use in patient care, and click on the Add button to save. We can now proceed to record a dialysis checklist. Select Dialysis Orders as shown to access the Orders panel in the new window. All patients with pending completion will be displayed in the View section. You can adjust the dates as needed to access the patient within a given time frame, then click on View. If your list is extensive, you can utilize the search bar to easily find and select a patient, and click on the Actions button and select Dialysis Checklist. In the subsequent window, fill in all the required fields. Select the checklist from the drop-down to specify items and tasks to be completed during dialysis treatment. Input date and time. This is critical for tracking the patient's timeline of care. Enter the remarks. The Remarks section allows users to add any additional notes or comments relevant to the dialysis session. Then click on Save button to save. You can document more than one list. After exhausting your list, close the window. Click on Actions tab and on the menu list, select Mark as Connected. Marking a patient as connected to a dialysis machine ensures real-time monitoring, enhances safety, and improves communication among providers, ultimately improving patient care. In the next window, enter the name of healthcare provider responsible for the connection, promoting accountability, and the exact date and time of the connection, ensuring accurate documentation of the dialysis session duration. Then click on Save to save your entries. Recording dialysis observations enhances patient safety by detecting complications early, tracks treatment progress, improves care coordination, enables personalized adjustments, and ensures compliance with medical standards. To record observations, click on the Actions tab. On the menu list, select Dialysis Observation. In the newly opened window, fill in all the required fields. Captures the exact date and time of each reading, enabling accurate tracking of patients' response throughout the dialysis session, and assisting in identifying trends or issues during specific intervals. Enter the patient's blood pressure here. Monitoring this is essential for observing cardiovascular stability throughout the treatment. Record the patient's pulse rate, which helps track their cardiac response to the dialysis process. Specify the blood flow rate, which is important to ensure optimal dialysis efficiency and patient safety. For arterial pressure and venous pressure, input the pressures in these fields to detect any blockages or issues in the dialysis circuit. Document the ultrafiltration rate and volume to manage fluid removal safely based on the patient's treatment plan. Record the dosage of any heparin administered. This prevents clotting in the dialysis circuit and ensures smooth blood flow. Enter transmembrane pressure, this pressure reading, to check for any potential issues with membrane functionality. In the dialysis temperature field, specify the temperature setting, as this is important for maintaining patient comfort and stability. Document any fluid intake or output here to keep track of the patient's fluid balance during dialysis. Use the Remarks section to add any additional notes or observations relevant to the dialysis session, and click on Save to save your entries. Taking dialysis order notes during or after dialysis observation is crucial for comprehensive patient care and effective treatment planning. To record dialysis order notes, follow the following steps. Close the current window. Then in the next window, click on Actions tab and select Capture Notes. In the subsequent window, fill in all required fields as needed. Record the nursing assessment immediately as it helps capture the patient's baseline condition, vital signs, and any abnormalities observed during dialysis. This ensures that the information is precise and aids in ongoing patient evaluations. Documenting the nursing diagnosis promptly allows for the identification of actual or potential health issues based on the assessment. This clarity assists the care team in addressing specific patient needs and tailoring interventions effectively. Noting expected outcomes during the observation period helps set clear, measurable goals for the patient's treatment. These outcomes guide the nursing staff in assessing the effectiveness of the dialysis session and adjusting care plans as necessary. Record the interventions implemented during dialysis ensures that all actions taken are documented. This provides a clear treatment history and allows for reflection on the effectiveness of specific interventions for future sessions. Finally, click on the Save button to save your entries. Remember, it's advisable to capture dialysis order notes before disconnecting the patient to ensure accuracy and enhance safety. This improves patient care and documentation quality. Disconnecting a patient from dialysis completes treatment, enhances comfort, and allows for monitoring and documentation for future care. To disconnect a patient, close your current window. In the new window, click on Actions button and select Mark as Disconnected. In the pop-up window, please enter the name of the healthcare provider responsible for disconnecting the patient to ensure accountability. Additionally, provide the exact date and time of the disconnection to ensure accurate documentation of the dialysis session duration. Then, click Save to successfully disconnect the patient. Marking a dialysis session as completed is important for accurate record keeping, effective care coordination, proper billing, quality control, and regulatory compliance. It ensures patient management is efficient and communication among providers is clear. To mark the session as completed, click on Actions tab and select Mark as Completed. In the new window that appear, fill in all the required fields. Enter the patient's weight immediately after the session to monitor fluid removal effectiveness. Capture the patient's blood pressure to assess their stability post-treatment and ensure there are no complications. Include any relevant observations or notes about the patient's condition, response to treatment, or any concerns that arose during the session. And click on Save button. On Actions button, you can also perform the following: make a lab request, make a prescription, schedule an appointment, bill a patient, queue a patient, cancel a dialysis order, view a lab report, and visit summary. To view the dialysis report, click on the flowchart as shown. In the next window, you can perform the following. You can share the report via email. You can save in various available formats. Moreover, you can print directly from the browser.